welcome everyone to the Richard Safe Workplace Lecture Series. Today we have with us Dr. Nale Lehmann-Willenbrock. She's from the University of Hamburg. She's the chair of the Industrial Organizational Accounting there, as well as the Vice Dean for Research. So she's done quite a bit and is quite the name for herself. I think it's over 100 articles now in journals.
Getting there.
Quite a few different books. She runs a center on better work. I think what her title of the center is, Center for Better Work. So I've worked with her for many years. I have not actually been working with her on.
I can be my own person without it.
So without further ado, Dr. Lee.
All right. Good evening or late afternoon, everyone. Thank you for having me. Yeah, I'm Nala. Joe, thank you for the kind introduction. And this is sort of an odd topic for me because typically what I'd like to do is go into organizations and record what they're actually doing. So I like to record meetings together with Joe. But this was a project that I did together with colleagues in the same faculty that I'm in who are experts in sports science. So they were really interested in physical activity, which is why this was part of the project. And I'm really interested in nursing home employees as a particular occupational group that is at risk and that has very specific challenges that we're going to look at in just a minute. So I was interested in that part and hopefully, finding some way to connect those two topics. So before I dive into the research project and the background, I would like to show you a slide just to give you a little bit of context why nursing home employees or caretakers are particularly important if you live in Germany. So if this works, doesn't. Yeah, I am.
Oh, okay.
It's okay. I'll just use this. Nope.
Maybe try escaping and opening the PowerPoint back up.
I'll just use the mouse. It's okay. Okay, so what this is an illustration of the so-called demographic shift in Germany, which you might have heard about. This is not specific to Germans. This is a problem that many European countries face. We like to mention Italy, where it's even worse, but it's pretty bad in Germany. And what this does is it simulates the development of the age groups across the entire country. So we'll start in 2004, and you can look at how the different, and if you're in the back, this is going to be very small, so how the different cohorts change. And as you might know, what we like to see if we look at the demographic makeup of a population is sort of a pear shape. Right. So as you can see, even in 2004, which is some while ago now, this wasn't exactly a pair anymore. So let's look at how this has been developing and how it's projected. We follow the years on the top left corner. This is where we are now. Okay, maybe we can pause here. So what do you think? What does this have to do with employees in nursing homes?
Going to need more.
We're going to need more, right? We're going to need a lot more because the trend in general, which has been there for a while and is going to continue in the coming years, as you can see here, is this is really growing out of proportion by quite a bit, right? So we have a lot more old people. People are generally getting older, right? Which is nice, but we have a lot more old people in relation to a lot fewer young people who are entering the workforce. So this has been a problem for quite some time. It is a problem now, and it's going to continue to grow to become a problem in the coming years. Okay, so what we've seen in the past is a very rapid increase in the number of health and care employees in general, right? So this is not just in the nursing profession, but healthcare employees in general. So we see that the occupational groups are kind of like following this trend in the overall population. If we look at the nursing occupation in particular, we can also identify some challenges that are very specific to this particular occupational group. And this first became visible and sort of, a key public debate during the COVID-19 pandemic, when we saw very severe nursing staff shortages, and suddenly that really hurt, right? People really realized across society that this was a problem. Connected to this is an increase in vacant nursing positions, right? So that need is not really being met. So just as an example, one statistic looked at what happened from 2017 to 2018 and saw almost a 50% increase in vacant nursing positions. So apparently this is not a particularly attractive occupation, or we simply don't have enough young people who are entering the job market who could potentially fill that position due to the demographic shift, which you've just seen demonstrated. Also, if you look at health and nursing employers compared to other types of employers, they need on average 50 more days to fill a vacancy compared to other sectors, right? So this is really a challenge. Contributing to this problem further, we see that chronic stress and overwork among the few staff members that remain increase turnover risk, and of course also contribute to further staff shortages, right? So it's sort of a downward spiral here. So this is sort of a backdrop for this project. So what we can draw from this is the conclusion that we really need to understand stressors in nursing homes, right? Both for research, but also for practical purposes, so we can hopefully develop some countermeasures. So what do we know about key stressors that are specific to the nursing profession? What you can see here is a graph that shows care professions, that's the dark gray bar, compared to all professions, right? And you can see that some of these numbers really stick out. So high responsibility is a key stressor that employees in nursing professions frequently mention compared to other professions. Having constant contact with the sick, which is inherent in this profession, as a stressor. Heavy physical exertion, for example, if you have to lift patients, if you have to carry them, if you have to hold them for longer periods of time, if you have to move them, is a typical stressor for these professions. Having to concentrate for long periods of time, and this is of course also correlated with staff shortages. Having too few or too short breaks as another typical stressor. Having irregular working hours or excessively long working hours. And again, these last two bars are of course also correlated with the general staff shortage in this profession. So pretty dark outlook, right? Pretty grim picture. So what my colleagues in sports science then like to do is think about ways to fix this. And for them, that typically means looking at physical activity, right? That wouldn't be my go-to measure personally, but this is what they like to do. So this is how this project came about. I was interested in this side of the story, right? What are the specific stressors? How do they sort of connect? Can we see some patterns in these? And my colleagues were interested in the role of physical activity. So this isn't too far-fetched, right? We know from research that regular physical activity is associated in general with lower perceived stress, right? So physical activity indeed can be a resource that can help reduce stress responses and sort of buffer against sort of a negative job setup in terms of high stressors. However, what's really important here is to distinguish between occupational physical activity, so physical activity that comes with a job, right? As in lifting patients or moving patients, as a occupational physical effort versus leisure time physical activity that you engage in on your own account, because they have differing health effects, right? And in sports science, this is called the physical activity paradox. So this finding that occupational physical activity may unfavorably affect cardiovascular health parameters compared to physical activity that you engage in during your leisure time. Why do you think that is? Wild guesses?
Work.
Yes. Could be correlated with additional stress at work. It could be a stressor in and of itself. Yeah, other theories? Why we see those differential effects?
More pulsed activity at work typically. You may have
Yes.
a brief period of intense effort and then lots of
Yeah,
inactivity.
exactly. It's about when that activity happens. It's about sort of the pacing.
Preparatory aspects of that as well.
Yes. Other opinions on the paradox?
Your perception of, even if they're the same activity.
Yes.
Your perception.
Yes, so perception, motivation, right? Physical activity at work is not something that I engage in because I decide to do so, right? Because I think it's good for me, but something that comes with the job versus a leisure time physical activity of my own choice. So yeah, lots of good reasons why we see those differential effects. So what about this in the healthcare profession in particular? There's a nice review that came out in 2023 that reviewed 17 studies that had been conducted to date on healthcare workers in particular. And what they found is across these studies is that healthcare workers typically engage in light to moderate intensity physical activity at work for long durations, right? So this just comes with the job. They also found that their leisure time activity varied from light to high intensity, but was generally shorter in duration compared to the amount of physical activity on the job. They found a negative correlation between occupational and leisure time physical activities, which makes sense, right? If you have a physically very demanding job, you're less likely to also engage in physical activity in your leisure time. And they also have some speculations in this review, I would call them, that this physical activity paradox that they again see here for the particular case of healthcare workers may be influenced by the fact that the healthcare profession tends to be predominantly female, but we don't know yet. So we took this and we said, okay, so that's nice, but healthcare workers are not necessarily elderly care nursing home workers, right? So what about the elderly care setting? So in the elderly care context, you have nursing workers, of course, but you also have other physically demanding tasks. So this provision of health services, as well as cleaning and cooking, tend to be physically demanding. So we thought, okay, let's look at everybody working in that setting, right? Not just trained nurses. There are a range of theories that would make predictions about what are resources and what are stressors in this setting. So as a famous model that most of you will be familiar with, I guess, is the JDR, or Job Demands Resources model, which explains employee well-being as having a balance between job demands, stressors, and job resources. Sorry, missing word. And what we know from prior research is that in nursing settings in particular, a main stressor that keeps popping up is having low influence at work, right? Low autonomy over how you do your job. And in terms of resources, this prior research has identified social support and leadership as sort of resources that help buffer against stressors. There's also one prior study on nurses working in these elderly care settings that has looked at work-related behavior patterns, physical strain, so for example, heavy lifting or holding, and long periods of standing, but also time pressure and pressure to perform as typical stressors for that profession. So you can see this is a sort of complex picture, lots of different demands and stressors popping up. And there's also one more study looking again at elderly care team settings that says, well, poor working conditions in general, and if you think about the demographic shift as a backdrop and the lack of workers or staff shortage that contributes to this as well, a lack of career perspectives, a lack of managerial support, so as the opposite of having good leadership, and also this discrepancy between what you learned during your nursing education and what you actually get to do on the job as a key stressor, right? And finally, and I'll return to this point in the discussion, bullying behavior among colleagues or between leadership and workers that contribute to turnover and tensions overall. Okay, so far, so good, not really. Okay, one more background slide, and then I'll get into our hypothesis and what we actually did. So I've mentioned lots of different stressors identified in lots of different studies. And it's pretty intuitive that these don't exist in isolation, right? But what's been done in previous research, including the references that I've shown you, is a focus on acute and chronic stressors, as well as resources such as physical activity, when indeed we know that these interact, right? There are interaction effects. So what this means is that we need some methodology that allows us to move beyond focusing on identifying single stressors. So what we used in this study is a method called regression tree analysis. Who's familiar with this? Good, I'm telling you something new. That's awesome. Okay, so it's an explorative machine learning method that's been used in health research previously, so we're not the first to make this claim. But that can help us identify individual stress profiles and complex interactions between stressors. And this is a tool that helps us detect systematic stress patterns that are characteristic potentially for chronically burdened occupational groups such as the elderly care settings. Yeah.
So, couple-
Yes.
Just so for context, what percentage of the nursing home population has like Alzheimer's in Germany? I'm just,
Oh, I would have to look that up. It's growing for sure.
is it
Um,
majority or something?
I would have to look it up. Yeah, I don't want
Yeah, I'm just trying to get a
to.
feeling for what applies.
Yeah, but like Alzheimer's, dementia in general is a problem. If we look at the patients and clients in these nursing homes, there's a really large percentage that has Alzheimer's or other dementia-related problems. So that will be about a fifth of the nursing homes that we looked at here.
Another question. Can you talk a little bit about what people, are these full-time jobs? Do they have benefits? You know, those sorts of things.
Yeah, so they definitely have benefits. A lot of them work part-time, and I'll get to that when I describe our sample. Okay, so finally, our research question. We had exactly one, and hypotheses. So we had sort of an overall research question, also because I wanted to play with that method. So I like new methods. I also like AI. Joe can attest to that. So our question was, can we identify specific stress risk profiles in employees of these nursing homes? And again, not just nurses, right, but people working in that setting in various jobs and capacities. And the second aim we had was whether we could potentially replicate this physical activity paradox, looking at stress as a mental health indicator outcome, with two hypotheses that resulted here. So one, we hypothesized that the extent of occupational physical activity would be positively linked to individual stress values. And hypothesis two, we expected that leisure time physical activity, as well as physically active transportation, would be negatively linked to individual work stress values among employees of nursing homes. Okay, does that make sense?
Can you describe what you mean by physically active?
Yes, good question. Sorry, this would be things like I choose to ride to work by bike, for example, right? So it's kind of like at this intersection of occupation and leisure time because I'm going to work, but I can still make an active choice to do that in a more physically active or less physically active manner. Okay, so we conducted a cross-sectional survey pre-COVID. That's kind of important because I just mentioned those massive staff shortages that popped up during the pandemic. So this was just before. We conducted this in a total of 9 nursing homes in the northern German area. So I don't know how familiar you are with Germany. These are different counties, different regions in the north of Germany. And we invited all on-site employees, including people working in the nursing area, kitchen staff, housekeeping, management, and also psychosocial workers. Participation was generally voluntary and also supported by facility management. So we had a total sample of 308 employees in these nursing homes. And we had to include a few cases. So one reason was that several participants had indicated that they had just recently experienced a major life events, for example, bereavement or divorce. So we said, okay, well, okay, anything we measure here is going to be heavily affected by that life event. So we didn't consider them in our sample. As you can see, and as expected, the majority of our sample was female. And we have about 2/3 that were older than 35 years. Yeah, we opted for paper pencil questionnaires with the first author present, partly because, yeah, technology is kind of limited in these settings, and also because we had a lot of workers in these settings whose first language is not German. So a lot of them had problems actually understanding the survey. So we had to like sit down and explain to them what certain sentences meant, what items meant, or explain certain words. Okay, so we used pretty standard measures, I would say, for assessing stress and stressors. So for chronic stress, we used the Trier inventory with sample items such as I feel overburdened by my responsibilities towards others, measured on a five-point scale, where an overall SSCS score above 12 is considered above average based on a reference sample, and a score above 23 ranks as heavily strained. Okay. So we had to include some cases here when people were missing more than 3 items because we couldn't calculate a meaningful average. And we saw overall a high reliability in this sample. We also measured job demands and resources using the so-called COPSOC, I think it's for Copenhagen Psychosocial something, that has a total of 31 subscales and covers 5 domains of potential job demands and resources. And a sample item for this scale was, do you work at a high pace throughout the day? Again, with items being rated on the 5-point scale. We saw some pretty decent internal consistency, and we set the scale to missing if participants completed less than 50% of the items here. Okay, we also measured the perceived relationship with nursing home residents with 5 customized items, so we had to come up with our own here. So for example, dealing with mentally altered and demented residents makes my work stressful. To what extent would I agree with that? And then finally, physical activity was assessed using the WHO Global Physical Activity Questionnaire, which covers 4 domains. So the extent that people engage in physical activity in their leisure time, during work, during transport, or when they're sedentary. And this had previously been validated for nursing context. Okay, very small font for those of you sitting in the back, but that was the makeup of our sample. So as you can see, the majority was female, right? I already mentioned this. We had a fair share of employees in the sample who were 35 years and above. This might be important for you also to understand our findings. So we separated them by occupational groups in our demographics. And you can see that we have only about 20% of the participants in our sample who were actually examined geriatric nurses, right? So these are fully trained nurses. Almost slightly more people who worked as nursing aides. So they've received some training, but not to the extent that we would like to see in this setting. There are some people working in psychosocial care, a few apprentices, some nursing management, so only about 3%. And then others is everybody else working in the setting, right? So in the kitchen, in housekeeping, you name it, everything else that, that was required in the setting. Looking at work experiences in these nursing homes, we see that the majority had worked between 1 and 10 years. More than 10 years were only relatively few. Okay, and going back to Kurt's question earlier, we also asked to what extent they were employed full-time, yes or no. And as you can see, that's about half, right? So half of them work full-time, half of them work part-time. And this is not just interesting from a descriptive standpoint, but also because a lot of the employees working part-time do so because they have additional caretaking tasks at home, right? So either because they have kids or because they actually have caring activities for relatives that are older. So a lot of these employees have additional burdens in their home environment that may create further stress.
But what's considered full-time work in Germany in terms of hours per week?
40 hours per week. Okay. So I'll talk a little bit about the correlations first before I dig into the regression tree findings. So just looking at the correlations, we see that the strongest predictors potentially of stress were work to privacy conflict, role conflicts, and quantitative demands. And if we look at physical activity and stress, just at the correlations, we see significant correlations between vigorous physical activity and stress, and also moderate activity at work and stress, right? And I'll return to the regression tree findings in a bit. Okay, so the aim here with this fancy machine learning method is to identify risk profiles of perceived stress, including all of the variables measured with the COPSOC that were at least moderately correlated with this chronic stress score value that we calculated for each employee in our sample. So what this gives you is a very cool looking hierarchical structure that consists of a series of if-then rules to predict the outcome of the dependent variables, so in our case, chronic stress, right? You get a tree with lots of different nodes, and each node of this tree lists the IV, or the independent variable, which best splits your data into further branches. And if values are lower than or equal to the depicted value at each node, reading on the left should continue following the true error, right? And each pictured node further than depicts the mean squared error, the remaining sample size, and the predicted dependent variable, in our case, again, chronic stress score that we're trying to predict. So it looks really pretty, I think, personally, right? And what this gives us is two types of stress profiles, right? So we find a resource profile and a risk profile, and participants in our sample will fall into either pile, if you will, right? Similar to the correlational findings I showed you just a minute ago, we see that the most important predictor of chronic stress is work privacy conflict here, because this is the root node at the very top. I'm sorry, this is super small if you're sitting in the back. So the very top of the slide, it says work family conflict. So this is where all of our sample is contained. So a high-risk stress profile was predicted by work privacy conflict, role clarity, right? So with lower role clarity, so more difficulty understanding what you're actually responsible for, resulting in higher stress. And we see a resulting stress score of 43.0, which is would be considered a very high stress level in comparison to our reference sample in Germany. What we also see from this risk profile analysis is that there are common stressor combinations. So we very often see combinations of work privacy conflict with role conflict, with a lack of role clarity, quantitative demands, unfair treatment, physical demands, and burden from resident-related challenges. Okay, so slightly bigger now. This is just the part of the regression tree that shows you the high-risk profile. So again, in this high-risk stressful profile, we see work privacy conflict scores that are equal to or above 53, where in the COPSOC, scores can generally range from 0 to 100, right? Role conflict scores equal to or above 70, again, ranging from 0 to 100, so fairly high. And lower role clarity scores than 37.5, predicting this overall stress value of 43, which really indicates a combination of stressors that predict extraordinarily high stress. What does this mean for our hypotheses? We were able to confirm the first one. So indeed, the extent of occupational physical activity was positively linked to individual stress values among employees of nursing homes, in line with what we would expect from the literature, but we did not find support for the second one. So apparently, we don't find this buffering function of leisure time activity or the choice for an active transportation mode. Okay, so summing up, we see that nursing home employees experience exceptionally high levels of stress compared to other professions. Okay, this nice new method called regression tree analysis helped us reveal a high risk stress profile where work privacy conflict combined with role conflict leads to significantly higher chronic stress. We saw that vigorous physical activity at work was associated with above average stress, so not very high, but at least above average. And again, contrary to our expectations and contrary to what the literature would suggest, leisure time physical activity did not act as a stress buffering resource in our sample. How can we interpret this? So there are quite a few theoretical implications we can draw from these findings. So first, we didn't find any significant moderation effect of role conflict in this relationship between work privacy conflict and stress, but their combination, so the combination of these stressors, still predicted high chronic stress. And this actually aligns with earlier findings linking both variables to depression and burnout as negative mental health outcomes. we see that work privacy conflict consistently emerged as the most dominant stressor across all 3 versions, right? Even when we were randomly resampling the data, this kept popping up as the most important predictor of chronic stress. And we can have an argument why that is. I think one possibility is we have a very high proportion of female participants in our sample, right? 80%. And on average, women are still disproportionately affected by work-life imbalance concerns, and that might be one explanation why this kept coming up as the main stressor predicting chronic stress. As a third theoretical implications, I'm all for taking this sort of whole system approach, right? So not just looking at one particular profession, but looking at the entire sample within a nursing home and including all professional groups, so we can better understand stress patterns in the nursing home setting. And I think this is interesting from a research perspective. It also makes a lot of sense if you go into these institutions, because of course people interact with other coworkers who do different tasks, right? And of course they can sort of catch stress or catch resources and social support from people of different occupational groups within the same work setting. Some more of these, and then I'll make sure we have enough time for discussion. When we restricted the sample to nurses only, this root stressor shifted a little bit to quantitative demands, which does suggest that we can see a nursing-specific stress profile that involves workload, work privacy conflict, and low commitment. Okay. We also see that influence at work and social support played a relatively minor role in predicting chronic stress. And this is actually contrary to the earlier studies I was discussing in the beginning. And this might reflect shifts in working conditions over the last decades. For example, there is increased economic pressure. I already mentioned staff shortages and demographic changes, which might just sort of shift the role of having influence in social support. What we also see overall is that physical activity emerged as a stressor, not a resource. Okay, so if you're not really a gym freak like me, this might sound really good. But of course, it also means that we're not really generating any benefits of physical activity for this highly stressed population here. What we do see, however, from a theoretical implication perspective is that we can extend this physical activity paradox to mental health outcomes in this elderly care employee setting. Okay, a few words on practical implications. One concerns staff turnover and stress, right? So this chronic stress that we observe in the sample, of course, increases potential staff over, right? We know that people will harbor stronger turnover intentions if they are chronically stressed, and this will contribute to the negative downward spiral in the elderly care. A second call for practical actions would be to reduce role and work privacy conflicts. Lots of things you could do for that, right? So some of these nursing homes are now experimenting with using more flexible schedules. Some of them are investing in team building activities as one potential way to help people even voice concerns or needs in the work privacy domain, and so forth. A third practical implication could be to rethink the role of occupational physical activity, right? So we've seen that vigorous physical activity can be quite harmful for already stressed employees. So we can think about how can we minimize that, right? So how can we minimize strain from lifting and rushing tasks? How can we use technology that at least helps minimize that unnecessary strain? Okay, and of course we can think about promoting more holistic health programs, and this is again where my colleagues from sports science would come in and be all over this, right? So how can we combine different types of activity to hopefully reap the benefits in terms of physical activity as a resource? A few words on limitations. So this regression-free analysis that creates all these pretty pictures that I showed you is exploratory by nature, right? So it'll only get us so far in terms of actual hypothesis testing. All of the data I've shown you is cross-sectional, right? So we gave them one survey. So we can't really make any causal inferences. This whole system sampling approach has the strength that it helps us capture diverse perspectives. That's great. But of course, it also introduces heterogeneity in our sample, makes our analysis potentially more complicated. And it also limits our ability to compare this with studies focused solely on nurses, right? So that's a choice or a priority to be set there. Also, if you look at how we measured physical activity, we use a standardized survey that's very often used in these type of settings. But of course, this is a self-report survey, and we know that people tend to overestimate everything, right, in self-report surveys. So when we ask them about the intensity of their physical activity, they may report that this is higher than, objectively speaking, we would actually estimate it to be. So this may limit the accuracy in how we measured this, and also, put some limitations on the conclusions drawn regarding physical activity. So to get away from this, we could potentially think about objective measures or more objective measures of physical activity. So for example, equipping nursing home employees with something like an accelerometer to measure their actual movement. But of course, this also comes with challenges, so people need to comply with this in the first place. And there's also a limited ability to actually capture all types of physical activities using this type of technology. But if you have a good solution, I'm happy to hear it in the discussion. Okay, future research directions, what's next? Of course, somebody should start investigating the effectiveness of strategies to actually reduce physical work demands, vigorous physical work demands in nursing homes. That will be one research direction. To address the challenges and the limitations due to our cross-sectional research design, there could be ways to make this better by using longitudinal approaches, also to potentially, I understand the stress-reducing effects of transportation or leisure time physical activity. And then finally, and this is where I'd like to start a discussion in just a second, I think we can do a lot more to account for the social dynamics in these sort of day-to-day elderly care work settings, including potential social contagion. It's not something we get by using traditional survey designs, but from other research I've done with related samples, I think this is a way to go. So the overarching question then will be, how do things like stress or resource profiles, like the ones we identified in this sample, potentially spread in a unit or in an entire care facility, right? How do social dynamics and care teams contribute to individual stress, like we measured in the current study? So what you see here is from a sample, not from the same nursing homes that we were sampling in this study, but a very similar one in a similar area in Germany. And what we did here was we went in and we've recorded their actual staff meetings that they were having each month. What you see on the left-hand side is the breakup of the conversation share. And then on the right-hand side, you see the percentage of different types of behaviors in the meeting. So let's maybe stick to the left-hand side. What do you think that is? 77%. It's a conversation share, so one person talking 77% of the time of the meeting. Wild guesses? Who did that?
Boss.
The boss, yes, thank you. So in this case, the boss is the one person in that team who's actually a fully trained nurse, right? Everybody else is either pretty quiet or says very little. And I mean, that wouldn't be so bad, right? We could argue that, okay, so if this is the one person that is properly trained, maybe it's good that he or she is talking so much and the others are listening and receiving that information. But if we look at the types of behavior that mostly that one person, but also a few of the others are showing, doesn't look so great. So this is a methodology that Joe and I like to use on typical meetings. This is a particular meeting in this elderly care setting. What you can see is that about 55% of their meeting time is spent discussing problems. That could be okay, right? But they spend a lot less time talking about solutions to these problems, right? Meaning that those problems are going to keep popping up meeting after meeting after meeting. And we also see relatively few action planning steps to actually make something, to change something, to make something different out of it. And what we also see, and this maybe doesn't look so bad intuitively because it's just 10%, but 10% of their meeting time is spent voicing so-called negative socio-emotional behaviors. Any guesses what those might be? You all only have fantastic meetings. I'm sure your colleagues show none of these behaviors. Joe, what are negative social behaviors?
Terrible job.
Yes, I did a terrible job. Yeah,
So it's pointing out and blaming is probably a likely
exactly.
thing going on.
Making problems personal, casting blame, right? Putting others down, gossiping heavily negatively, right? Interrupting each other, talking over one another. And we know from our research on lots of different meetings that these are behaviors that are really bad for team morale, right? So this, in my eyes, is potentially another way to go if we are to address stressors in this particular setting. Okay, I'll leave you with that in terms of input, so we have lots of room for discussion. Thank you for your attention.
Was the reported moderate physical activity in minutes per week, or just thinking of the actual dose of physical activity?
I would have to look it up, but it was, yeah, probably, I think for leisure time was around a half an hour on average. It's a lot lower than we would like to see if you think about recommendations, right? For on-the-job activities, it differed by occupational groups. So as we might expect, right, people working as actual nurses or in this nursing capacity reported much higher percentages, so up to 80%. Some of them had to move patients quite a bit. Yeah, so, and particularly if we looked at vigorous physical activity, which we saw was one of the predictors of chronic stress, that tended to be higher among nurses compared to other staff. Yeah. Other questions? Please.
You mentioned that you had to get interpreters frequently for the pen and pencil paper questionnaire. I was just didn't see where maybe you mentioned I missed it, but what is the demographic of where people are these an immigrant population or?
Not really. They have a fairly high percentage of immigrant workers compared to other occupations. Yeah, I think it's roughly 20 to 30%. And immigrant workers tend to be higher among the less trained occupational groups. So particularly kitchen staff, very often immigrant workers. Usually the people working as a nurse or a caretaker have enough German to get by, right? So they can have conversations with the patients, with the residents, with their families. That's pretty important. But that's still quite different from looking at a research developed type of questionnaire where they just had problems understanding some of the items. Yeah, we were going back and forth about, okay, so to what extent do we just want to adapt these surveys, but then it would be less feasible to compare our findings against previous studies. So we opted for the original items, also for the COPSOC, at the expense of, yeah, some employees telling us, why don't you make that simpler? Why can't you phrase that in more simple words? Yeah. Other questions?
Was the active transportation done by choice, or they didn't have, like, that was the only way they could get to work?
That's a good question. We didn't ask that. We should in the future. I would say it's by choice. I mean, all of these nursing homes had bus stations in front of them, right? So they could have taken public transportation. Yeah, but that's a good question. And you might also argue that, you know, if somebody lives further away, it's just not feasible to go by bike or take a more active mode of transportation. I don't think we asked for that, but yeah, good point. I'm glad we're here too. We didn't think of that. Yes, please.
Can you give some examples of work privacy conflict? The word privacy has multiple interpretations. Just want to make sure I understand.
The work privacy conflict are items like when I'm at work, I'm constantly worried about my children at home, or when I'm taking care of my family, I feel like I'm not fully, I haven't fully engaged at work, or yeah, I have trouble reconciling demands from my job with demands from my private life, for example. So, yeah.
Perfect. Thank you.
Other questions?
What's the typical percentage of negative social emotional behaviors in a typical workplace meeting?
Less than 5.
Okay, so this is almost double what you would
Mhm.
typically see in a workplace.
Yeah, it's also behavior that we typically consider socially not quite acceptable in professional contexts, right? I mean, you can get away with gossiping some, but especially these behaviors that openly cast blame, which we see a ton in the sample, and this is just one out of several meetings that we looked at, that tends to be socially considered as not socially acceptable, right? Sitting in a meeting where you say, you did this wrong. So this finger pointing behavior, which happens a lot here. We also asked them after the meetings, was this typical, right? Was this a typical meeting for you? Because we also always want to know, did the camera somehow cause them to behave very differently or to impression management? And all of them said, yes, yes, this was quite typical. And we also asked them, do you think this was a good meeting? Oh yeah, this was a good meeting, right?
Yeah.
Okay, so yeah, I think this could be a starting point to study some of these social contagion dynamics. Yes, please.
So supervisor support for family life generally is effective for reducing work-family conflict. So I wondered, I don't know if this is exactly the question, but and seeing these data, I'm kind of wondering about the role of leaders in creating both support for family life and work, but also just the climate for complaining or negativity. I'm wondering if there's an organizational measure of
Yeah.
negativity in the work environment, because leaders are probably driving both.
Yeah.
The support for work, personal life, and also the climate for, tolerating or even role modeling super negative behavior in meetings.
Yeah, that's a very good point. So yeah, I would agree. I think this is also a problem that sort of trickles down. And this is something we noticed when we first recruited these organizations, right? So just how management was talking about even finding time slots where we could ask people to answer those surveys. We had a lot of going back and forth whether this was even considered work time or not, right? Or they were just doing this as a hobby. So that was tricky. Yeah, so this sort of negative stance, I think that runs through the organization. And it's also interesting to look at who becomes a leader in these organizations, right? So very often what happens is the one person who has okay training will lead these meetings. They were not qualified for that, right? They were never trained to be a leader. They were never trained to think about, even reflect on how do I talk to my fellow coworkers. They don't really have any facilitation skills. And the same holds true to a lesser extent when you look at general management, right? So they're often very skilled in terms of task-related skills, but their actual leadership training, right? What we would consider leadership training is often very narrow to non-existent. So very clearly that's a problem, and maybe also a hinge point for interventions. Other ideas, yes, please.
So I understand the mean statistically, but did you happen to look at who ended up in your highest stress group in terms of how it compared? For example, more aides, younger workers, and those sorts of.
We didn't see, so that's the beauty of this regression tree, right? It just looks at everything you have, right? So we didn't see any demographics coming up as significant predictors. I wouldn't overly want to interpret that finding because it's still a relatively small sample. So it might very well be if we had drawn a larger sample that we would have seen demographic influence here. And also if you look at the gender distribution with 80% female, there's just not, and this is true for other demographics as well, there's just not enough variance, I think, for that to come up as a significant predictor that really distinguishes between different stress profiles.
My argument is in theory, something may not be statistically as you go.
Yeah.
To get to the bottom, after all those decisions are made, you may end up with a group that doesn't actually look like the original group.
Yeah, that's a good point. Yeah, so we looked at that in terms of the different professions, right, that were in our sample, and we saw those slight differences for nurses versus the other groups. But yeah, that's a fair point. So we may have to dig a little deeper if there aren't more specific subsamples that are maybe a mixture of demographics and particular occupation within the sample.
I think I might just have a general comment. And really, there may be a root cause in the industry, and probably not just in Germany, but elsewhere, of understaffing, the percentage, how long it takes to fill positions, how many positions are open. And so I can imagine being a leader and a worker in that industry, if you're always understaffed and everybody's doing 1.5 jobs or 2 jobs.
Yeah,
So I feel like encouraging another layer of troubleshooting, which is like economically or culturally, what could the country do to increase staffing in this industry?
yeah,
Um,
yeah,
it's very tough. I've done work in caregiving and trucking, and both industries are kind of chronically trying to fill positions.
yeah.
And so everybody's doing too much, and that's kind of a root cause of lots of trouble.
Yeah, like frankly, looking at how they describe their work days to us, right? I was like, why are you working here? to begin with? Really makes no. But a lot of, particularly in the nursing professions in our sample, a lot of them have very strong value systems that this is what they want to do, no matter the pay. However, I think in terms of attracting new employees, that's a tricky strategy to have, right? And it's also sort of a recipe for burnout. So yeah, so I agree. There should be economic measures. In Germany, there are currently a lot of discussions about just remunerating those positions better, which is a problem, right? If you look at the demographic makeup, it's just, we need so many of them, and so many people will move into elderly care at some point, or require elderly care at home, that addressing this systemically and really, across organizations, paying them more would be tricky, to say the least. But yeah, I agree. Yeah, that would be a potential fix for that problem. Yeah, so there have been some measures. So we in Germany we pay healthcare, and we also pay sort of like a potential caretaking fee along with our insurance fee. That's trying to get us in a position, or the country in a position to address the economic shortfalls here. But I think it'll remain a problem for a few years until somebody comes up with a magic solution. Yeah. Yes, please.
Solution, at least in the US regarding the ergonomic stuff, is probably best the zero lift program, if you've heard of it.
Yeah.
And the irony is there's relatively few locations online, and the strongest data people didn't publish it. I mean, I have access to some of the data, but we're talking about like 90% reductions in musculoskeletal
Yeah.
back pain, and so there's a lot of, and it's not with expensive equipment either, but it does take training in how you use gait belts and flip sheets and all this sort of stuff. But it does exist. Again, unfortunately, they write this stuff up.
Yeah.
We can get you some of that.
Yeah, I think my colleagues would love that as well. So particularly Bettina Wollesen, she works a lot with nurses, and she has invested a lot of effort into intervention studies, trying to tackle exactly those problems. So what do we do about chronic back pain? How can we prevent that? How can we build that into the initial training they receive when they may be young and this may not feel relevant yet, right? Yeah, so she spent quite some effort. Yeah, so please share if it's not published yet. Okay, other secret tips for my colleagues? Are there any questions online that I missed?
There are not.
Okay, good. Thank you.
Thank you.
All right.